So I'm going to start out with some of the urinary component to this over the renal component. Just get it out of the way so we can really dig into the renal in the slides to come. But in the urinary component, I know that you're looking at kidneys right now, but you can see this is an example of compensatory hypertrophy. And basically what happens in this process is you see the kidney on the left is a great deal smaller than the kidney on the right. The right is almost twice the amount of size. And what happened here is that there was an obstruction to the outflow for the right kidney. So the left kidney basically had to pick up the slack, and seeing as it has to work harder, it hypertrophies and it gets bigger to handle this extra work. And this is what happens in your body when something would happen to one of your kidneys. The other kidney will work that much harder and become bigger. Another problem in urinary pathophysiology is kidney stones. I'm sure we've all known somebody with kidney stones, but as you can see in the pictures above, the first one are the different types of kidney stones that they can be and the components that make them. You notice the calcium, the uric acid, the struvite. Now the struvite's important because that's what makes your staghorn calculus. And then crystalline is that one in the lower right. Now the middle picture there shows you all the different places that you can see kidney stones, and it shows you where that staghorn kidney stone is. It's right in the middle, and it gets into that urinary system. And then the far right shows what that looks like in an actual kidney. Look at how that kidney stone is right in there, preventing urine from flowing out into the ureter. Another urinary issue is stress incontinence, and this mainly happens because of a weak pelvic floor. Primarily, this occurs in females, specifically, say, after childbirth, when that pelvic floor sags because it's not as strong and tight as it used to be. So if there's any pressure coming from the top, such as in coughing, sneezing, laughing, urine is allowed to leak out because those pelvic floor muscles are weak. The last issue I'm going to cover with the urinary system is urinary tract infections, and we all know this pretty well after we did our assignment from last week. And this is just basic parts to review with urinary tract infections. Basically, the causes are listed over to your left here. Being a woman with that shorter urethra, sexual intercourse, catheters, we all talked about that biofilm, suppressed immune systems, diabetes. And then the middle picture is just, again, talking about that bacterial biofilm and its contribution to urinary tract infections. And then the last one is just a brief overview. Symptoms, risk factors, we've already covered this, how they get diagnosed. It's amazing to me on there it doesn't have a urinalysis, which is very common and the best way to start, and then also management. Now this is a picture of the glomerulus. The left-sided one is normal. The right side is one with diabetic glomerulopathy. And basically what you can see is that changes have occurred. So because of this increased glucose, the kidneys have to work harder to try to filter out all that extra sugar. So to increase the excretion of that glucose, which is what the kidney is trying its best to do, it needs increased blood flow and increased filtration pressure to get that glucose out. And I'll say that again, it needs an increased blood flow and an increased filtration pressure. So due to this increased pressure, this leads to an increase in the capillary pores. It also changes the membrane by thickening it and damaging it. And you can see that in the picture, the one on the right there has that greenish outline that the one on the left does not have. So now you have this thickened, damaged membrane, and this leads to it all becoming scarred, which it damaging the membrane. This allows the mesangial cells to grow and occlude the capillaries, which you can see on the right side there of the picture. Now, because of all these factors, that glomerulus becomes sclerosed, which is a type of scarring and can't function how it's supposed to, as you can imagine as you compare the two glomeruli above. Now, as a provider, one of the things that tips you off to this are a urinalysis that indicates microalbuminuria, seeing as these little albumin components are now able to leak out into the urine. The next common chronic renal issue is hypertension. And what chronic hypertension does is it causes the renal arteries to change. They become thicker to compensate for this increased pressure, and that narrows the inside diameter of those vessels. This also, because there's a narrower diameter, less blood can get through, and this less blood flow damages the nephrons and changes the glomerulus, as you see above. Another issue within that glomerulus is glomerulonephritis. And you can see in the picture this typically happens with strep. And with the strep infection, the body creates an antigen-antibody complex, if you remember from the immunity lecture, that gets deposited in the glomerulus. This sets off an inflammation reaction and ultimately leads to bloody urine, edema, proteins in the urine, lethargy, low-grade fever, all the things that you can see above in that picture. The next problem is nephrotic syndrome. And the issue with nephrotic syndrome is a spilling of proteins. So what will happen is, as you can see on the left, in a normal glomerulus, you'll keep your proteins in the plasma. Now, in nephrotic syndrome on the right, you see you're spilling proteins so that oncotic pressure is decreased in the plasma. But in the urine, you'll see a ton of proteins. Now, this also affects the entire body because now you don't have a lot of protein in your blood, so you can't suck up fluid into the plasma anymore, and it stays in the tissues. That poor little girl in the bottom, as you can see, is so swollen because of this phenomena with the protein with nephrotic syndrome. The next topic is going to be acute renal failure, and this is renal failure that abruptly happens, and a lot of times it's for a reason. The number one reason, as you can see above, is dehydration, and this just lists a whole bunch of different reasons why this happens. Now, remember with acute renal failure that this can mean the creatinine just jumps up from, 0.7 to 1.7, and it's an abrupt rise in creatinine. Above is the Rifle criteria, and this helps providers assess the severity of the acute kidney injury. So the first three really looks at the severity. The last two look at the outcomes, as I'm sure you remember from your PowerPoint. So just have an understanding of the components of this scale for the exam. Now, these two pictures are describing acute tubular necrosis, or what ATN, and this is an acute issue that is typically caused by renal ischemia or nephrotoxicity, and that comes in three stages. There's the inciting event, or why it happened, and then the maintenance phase. Now, this can kill people, and when people die from this, it's typically in this phase because they're not making a lot of urine, their potassium's high, they have metabolic acidosis and uremia during phase of this process. And then the last thing is the recovery. And both of these slides get a little bit more into detail in case you wanted to know more about that. And I will, I know you can't see a lot of it there, so I'll also submit this PowerPoint to bring up if you wanted to look more closely at these images. Another acute issue is HUS. And this, as you can see, is when you eat contaminated meat and get an E. coli infection. And basically, the bacterial toxins bind to glycoprotein receptors in the intestines and the glomeruli. So these people will have acute kidney injury as well as like bloody diarrhea, intense and abdominal pains. And this is what characterizes HUS. Lastly, we're going to talk about chronic kidney disease. This is very prevalent. You'll see it everywhere. And the pictures above on the left, it shows the most prevalent reasons why people go into chronic kidney disease. And then the picture on the right discusses the stages of chronic kidney disease. Now, remember with stage 5, they will need an intervention to stay alive because their kidneys are just not functioning, whether this is dialysis or ultimately a transplant. Speaking of dialysis, these are all the reasons why dialysis is started. If there's fluid overload and their lungs are full of fluid, you're going to want to high potassium that threatens their cardiac function. If they're neurologically declining and becoming confused because of their uremia, these are all things and reasons to start dialysis in these folks. I just wanted to take a second and bring back the concept of hyperkalemia. Now, patients with renal failure really struggle with high potassium. And as you remember, this can cause dangerous and deadly cardiac arrhythmias. And this is one of the reasons why patients go on dialysis. So people with end-stage renal disease really need to be careful they're not getting too much potassium. Now, as you remember in your homework assignment, hypertension is a symptom of chronic kidney disease. And this just depicts why this hypertension happens within the glomerulus as a result of angiotensin II. Just to jog your memory and help you remember from your homework assignment another symptom that occurs with chronic kidney disease. And lastly, these are some of the cardiac issues that you can have with chronic kidney disease. I think that this slide really helps to review. You see up there chronic heart failure, uremic cardiomyopathy. You can also have pericarditis. You can get pulmonary edema. You can get accelerated coronary artery disease. So all of these things occur in chronic kidney disease that affects your cardiac function. It cut out there. So anyway, everyone, good luck on your exam. This is just covering the renal material that will be reviewed on the exam. If you have any questions, please either contact myself or Leslie or Marcia. I don't know what class you're in, but good luck, and I'm going to get started on the cardiac one.